I'm Dr. Jim Coyle, and this tutorial on challenges in human behavior focuses on substance abuse. First, it's important to recognize that substance use has a continuum, moving from beneficial use, which is positive health, social or spiritual effects, to casual use that's generally non-problematic, to problematic use, which is associated with negative consequences, and then to, chronic dependence or addiction, in which the use has become compulsive or habitual. 4 C's can help us identify problematic substance use. Is there craving? Is there a loss of control? Is there a compulsion to use? Is there continued substance use despite consequences? When people have problematic substance abuse, one of the things that this can lead to is tolerance. And tolerance is when the same amount of alcohol or drug use results in a lesser effect, requiring a person to increase the amount of use in order to get the same effect. What tends to happen is that eventually there might be a reverse tolerance where the amount of use remains the same, but the effect increases. This usually results in an increase of negative consequences. Factors associated with tolerance are a person's age, weight, and sex, their medical conditions, the combined use of alcohol, drugs, or various combinations of that, as well as the amount consumed. When we think about alcohol and drug abuse, we also think about addiction and the issue of withdrawal. Stopping can lead to withdrawal, which can be very dangerous and even cause death. Symptoms of withdrawal are nervousness, irritability, agitation, chills and sweating, diarrhea, nausea, stomach pain, insomnia, and body aches. The severity and length of withdrawal is influenced by the drug type, the length of drug use, and the amount of drug use. As with mental illness, there's a wide range of theories explaining substance abuse and addiction. Genetic or biological theories focus on the neurobehavioral issues, while psychological theories tend to focus on conditioning or learning theory, personality issues, or use of drugs or substances as a response to stress or an attempt at coping. Sociocultural theories tend to focus on how society and community influences a person's substance use, relating sometimes to a cultural meaning of alcohol and substance abuse, how it is a activity that friends engage in, or a reaction to racism or oppression. As we've talked about in other tutorials, ecological or biopsychosocial models tend to focus on multiple levels that relate and influence substance abuse. A different type of model is the trans-theoretical, which identifies stages of change. It was it was proposed by Prochaska and DiClemente, and identified a number of stages related to the person's readiness for change, starting with pre-contemplation, where they don't think they have a problem, to contemplation, where they may start thinking about it, to preparation, where they may think of, well, maybe it's something I should do something about, to action, where they're ready to make a change, and then maintenance to maintain change, as well as being able to manage relapse. Intervention models based on this trans-theoretical stages identified the state of change and focus on moving to the next stage. For example, if a person denies having an alcohol problem, the response, which is a pre-contemplation stage, the response may be to focus on, well, what would make you think that a problem could be there, which would be a contemplation stage. Or if a person is saying, I'm concerned about my drug use, but I'm not sure I'm ready to do anything about it, which seems to be a preparation stage, you may want to ask them, what do you need to think about in order to move yourself towards being ready to do something, which is an action stage. Another way of responding to substance use is harm reduction, which aims to reduce the harms associated with the use of substances. It focuses on preventing harm rather than on prevention of the drug use itself, which is what traditional treatment tends to focus on, which is the abstinence from the substance. So this is an alternative for people where that doesn't really work very well. CAGE is a simple screening tool to assess whether someone is really having a problem with alcohol or substance use. C is ever told to cut down. A is ever annoyed by someone criticizing your drinking. G is ever felt guilty about drinking. And E is ever have an eye opener, a drink in the morning. Certainly a biopsychosocial assessment would focus on a number of things, including the role of substance use related to a person's personal development, their patterns of use, whether they're drinking daily or binging or using substances with friends or by themselves, as well as the possibility of using substances as a medication to deal with trauma. One of the assigned readings discussed the importance of looking at co-occurring substance abuse and mental illness in youth. The article reports that there's an estimated 23% of Canadians ages 9 to 19 that have mental illness, while 2 to 5% of Canadian teens have severe substance use disorders. 12% of high school students reported having anxiety or depression as well as substance abuse, but only half of them were able to access services for mental illness. These statistics suggest that there's really a need to pay attention to that in youth. So what do we know about addiction? One of the things is that we have been taught a lot about how substance use can lead to addiction, and to a degree about it being kind of a biological thing that happens. But lately, people have been questioning this, asking whether addiction is a socially constructed concept. Is it biological, psychological, social? And how do our beliefs about substance abuse and addiction influence our interactions with clients? The TED's talk by Johann Hari makes some very interesting comments about what we think we know about addiction. And so I'd like you to kind of watch that and jot down your reactions and what you think about it, where you think it's valid, where you think it may not be valid. Another assigned reading had you look at a very different way of approaching treatment for alcohol or substance abuse, and that's an Aboriginal Healing program, which focuses on health promotion, harm reduction, and community-based healing. They use 7 sacred teachings as the focus of their healing: love, respect, humility, wisdom, honesty, and truth. Compare this with the traditional models of treating substance abuse, which are focused on acknowledging that you are dependent upon a substance, that you don't have control, and that you must abstain from this. That's a very different way of looking at how do we deal with this. Also compare this with Johann Hari's suggestions Where does it fit? Where doesn't it fit? And jot down your ideas about that. In this particular Aboriginal program, interventions are focused on connecting spirit, body, mind, and heart. They use community-based healing models that restore a sense of belonging and emphasize the wisdom of traditional teachings. They promote balanced health and restore the roles of women and elders. The focus is not only just strengthening an individual, but strengthening their family as well as their community. So this is a very different way of thinking about how to provide services for people affected by substance abuse. Taha proposed a continuum of care model for people who are affected by opioid use. In this particular model, they focus on where is the person at this particular stage of their usage and how is it affecting them, and the treatment tends to be more focused on that, as well as acknowledging that there is an ongoing need for treatment. It starts with a screening and assessment, has brief interventions through rapid access clinics and community outreach, has withdrawal management, includes pharmacological interventions and psychosocial interventions, but it also focuses on recovery and sustaining wellness and ongoing care, acknowledging the fact that it's not just a matter of treatment occurs and then there's no longer a problem with opioid use. It's a matter of recognizing that there's a lot of factors that influence this, and that this needs to be an ongoing care model where people continue to get some support after they've stopped using opioids. The program also looks towards reducing stigma and harm reduction. So as I've mentioned in previous tutorials, these note that you take on your reactions to what you've been reading and viewing in the videos, as well as thinking about in these tutorials, can help you in an in-class exercise where I'm going to ask small groups to kind of talk about how do you assess alcohol and drug use in your clients? And when you notice that there may be a problem, what do you do about that? How do you determine what you would recommend for the client? And so we'll do that in class. And as I've said in the past, we'll also have a discussion about what you've learned, what you have questions about, and what your experiences are with your clientele. And so how this all comes together for you to learn about substance abuse and how social workers can help clients with this. I look forward to talking to you in class about this.